Hello, how is everyone today? I am so excited that you're here with us. I have Dr. Sunni Patel with us, and he is out of London. And you all are in for a treat because he is going to be sharing some incredible gems, not just from his own story, but really like how this can help you in your journey of health and healing. So powerful. So, this is our How to Heal Naturally podcast. We are going nationwide with this. And you all, I just encourage you just to sit back, absorb, and receive what Dr. Sunni has to say to us today. Dr. Sunni, thank you for being here with us. This is so great. Tell us, how did you get started in this field?
Yes. Well, look, thank you so much for having me, Chef Galen. I love your enthusiasm, the energy that you're already bringing. I have to say that's probably the most exciting Dr. Sunny I've ever heard. So I have to give you a kind of kudos for that. So where did it all start from? Like, when I explain it, people think it should be made into a movie of sorts. So I've had a very rich and diverse kind of background and career. I've always been in healthcare, but I started off as a clinician. I started off actually in ophthalmology and optometry eye care to begin with. And then that built up in terms of the passion and the kind of the work that I want to do around healthcare and empowering people. So I've worked in academia, I've worked in research, I've worked in private practice and public health services as well. And that evolved into working in the corporate space. So a lot of people are going to give me a boo and a hiss here, but I have also worked in the pharmaceutical space as well. But that informs enough kind of understanding for me to know where there's a place for medication and where there's a place for really healing naturally, like you say, and healing wonderfully through the power of our own empowerment. And unfortunately, I've kind of learned that personally as well. So I have a chronic gut health illness and condition. And because of my own burnout and not really kind of prioritizing my own health and well-being, I was hospitalized twice during lockdown, which gave me that aha moment and that ultimatum to myself, which is, what are you going to do to survive and live and be the best that you could be? I went on my own health journey, and through that, I then thought, I want to empower more and more people so that they don't do and make the mistakes that I made. So I retrained in nutrition, in lifestyle medicine, eating addiction, and I'm a personal trainer and fitness instructor, and I kind of bring more of a holistic system. My clinic is based on 4 kind of body systems: the mental, the emotional, the physical, and the spiritual harmonization through healing. So it's through my own arduous journey that I now help people kind of on their own journey of empowerment.
No, I love that. I love that. So when you were in that space and you weren't feeling well and you were thinking to yourself, okay, I have this PhD in this, like I should not be where I am, right? It's a little humbling. I mean, I feel the same way. So like when I get sick, I'm like, oh, I say, like, when do you remember actually just sitting there? Do you remember that like aha moment when you had that complete shift of like, this is like, I have to take a different direction in my life right here?
Yeah, it's a great question, actually. And it came to me not from the aha moment, it came from me from the darkest moment.
Okay, yeah.
So I was forced to go to the hospital with my symptoms. You're right. I have all the understanding of knowing how to avoid risk of disease. That's what I've grounded all my learning from. And because it was COVID and it was just a horrible time to be in a hospital, I assumed, like most medical professionals and healthcare professionals, that I'll go in, they'll say, look, you're fine, just go back home, you'll be okay. The admitting nurse, when she said to me, right, we're admitting you so that you will be staying in hospital, I just cried. I literally cried. I was like, this is not who I am. I have always helped people. I have never been the patient. And she just said, this is now your time to realize that you need looking after. And when I was in a ward of other men that had other health issues, some were recovering from long COVID, some had other gut health issues or gastrointestinal tract issues. And it just dawned on me, this was my aha moment. You are not going to get back into hospital again. Now, I am also quite smug. Like most healthcare professionals, we don't always practice what we preach. 6 weeks later, I was back in hospital, admitted again. That's when I had the ultimatum. The ultimatum was you carry on with life like this,
Okay.
playing Russian roulette with your life,
Yeah.
or you do something. And that's when I thought, okay, you know what, no more. And I decided to leave work and really focus on myself. And I had what I call my health awakening, health sabbatical. So that's what it was. It was the deepest, darkest moment. And being, you know, a 30-something-year-old sitting in a ward with elderly people that actually need that care. And for me, thinking that I'm wasting a bed here, somebody else will probably do with this bed. That's where it kind of made me go on this journey.
Yeah, that is powerful. That's why I love following you so much. And if you all can feel this, I mean, honestly, this is one of the best things that I love about Dr. Sunni is that nothing is more powerful than when you're in the hands of someone who knows where you're at because they've been there too. You know, I love that. And I love that about you because you are what you preach, like what you say. And you've been there, you know, you've been there with us. It's like a dentist that's never had a cavity. It's like, wait, how can you understand where I feel? You know what I'm saying? It's like, you've been there. So when you were there, how did you take it from healing your own personal self to actually making it like, this is the direction of your business now?
Yeah. So look, it's a great question. Thank you so much for the compliments. Look, I never want to be altruistic from a pious perspective. I want to be altruistic from a point of understanding and empathy.
Yeah.
And the reason why I work with my clients and the reason why my clients continue to work with me is because they just say, Dr. Sunni gets it.
Yeah.
He gets the dirtiness of health, right? And when I mean even the dirtiness, I mean, I've gone through depression. I've gone through an eating disorder. I've gone through a gamut of traumas in life, which means I can sometimes take a step back and also say to people, look, if I've done it, you can do it. And that's how the clinic came about. The clinic was never meant to be, Galen, I can tell you now, when I left clinical practice and academia, I said I would never work with people one-to-one ever again.
Really?
In my life.
Wow. Yeah.
I've always said this, you know, I'd always said no more. It is not me. I don't have the patience and I just don't have it in me anymore. But this gave me a brand new lease of life because I built it based on purpose. My purpose comes from, I don't want people to go through what I have had to go through and have had to go through what I've had to go through. I want to show people that if you get the right support, you can really master the power of your own empowerment and being to get yourself out of it and build the toolkit for life. So that's how it came about. It came about because people naturally came to me and said, well, if you've done this, and you've got all this knowledge and qualifications, why are you not using it? Like, what are you doing with your life? And I just thought, well, I didn't think it was me again, but now I found this new purpose, this new energy. When I have my sessions with my clients and I see the turnaround, it may be something really, really small as a realization, or it may be something as big as a reduction in symptoms. It just fuels me, it feeds me, and it keeps me away from the hospital. Let's put it that way.
That's so good. I know you're giving me chills. That's so good. That's so good. So where do you see this going? Where do you see this going? Because we're like, through this, we're going completely global. Do you see, because it just seems like everyone is craving this. And that's what I love about you too. Like, it's not just about eating right and doing your fitness, but you go deep into people. You're like, you know, let's see what's really going on there. Let's shift the mindset. Let's like, look at the trauma. Like, let's get rid of that. Where do you see your vision going?
Yeah, so look, it's a great question. I always like to think big, but then I've always realized that you've got to think big in the most rational way. And I think it's because you've just hit the nail on the head in terms of even my own journey of developing on how I work with clients. I use my own framework. It's an award-winning framework, which I'm really pleased and proud of. But it's because we get into the guts of it all, pardon the pun, because I'm all about gut health.
Yes.
But we've got to realize that sometimes diet, nutrition, exercise, sleep, they're all, you know, it's a plaster. It's a plaster on top of the wound. And the wound sometimes is, like you say, the trauma, the triggers, triggers, the things that we actually sometimes are too scared to actually dive into and understand, so that we can then put diet and nutrition and movement and mental well-being and sleep, because then those can actually serve us better. So my vision and dream is to help more and more people. On LinkedIn, I have this vision, which is to help 1 million plus healthy, high performing professionals find that balance between work life and health. And that's just because of my corporate background, but it's really to help as much people. I do really want to scale it up. I want to show people that actually this framework does work, and then indeed then try and create more academies around that. For the moment, I'm really enjoying the power of one-to-one work, because I've stepped away from it, for 10 years. And now to get to know someone deeply, I know people, I know their children's name, their dog's names, I know the childhood, the school that they went to, and I just love that. But I know that over time, I do want to start creating more kind of group programs, global programs, and academies, so that people can understand their physical, their mental, their emotional, their spiritual well-being.
Yes. No, yeah, you've done a lot, which is amazing. And I love that you were in a space, and it was like almost like you ended up getting burnt out with the one-on-one. And then once you shifted your work and really the alignment of what God really had for you, now you like fly in it, because that one-on-one is so deep, I love that. So what are some techniques that you can give to our audience that they could take away today to really just find that place of alignment and healing and preventative that you feel is super important?
Yeah, so look, I think the first thing is, and this is really important, you need to be gentle, kind, and patient to yourself. The one thing I've learned, and the reason why I pride myself on my work, is it's very personalized to the individual. Right, my motivation is going to be very different to yours, Chef Galen, and that's also going to be very different to someone else's, and because that's shaped by experience, traumas, and beliefs, whether they're perceived or true reality beliefs as well. And because of that, it means that we've really got to appreciate the humanistic element of ourselves. We are human, sentient beings, but that means that we've got to be very thoughtful and have a centered approach. That's my first thing.
Yeah.
So other than the patients, I think it's also, and I firmly believe in this, is about trying to have an evidence-based support system and network around you that actually helps you to deliver the health goals and outcomes that you want. Now, evidence-based can mean a lot of things. I don't just mean things based on, random clinical trials, randomized clinical trials, or gold standard data. Sometimes you can be your own data set. Okay, create our own empirical data from experience. But what I would say then is, we shouldn't then say, well, because this worked for me, it will work for everyone else. This is sometimes the issue we have with healing naturally. We draw these conclusions and try and make them very generalized and specific. And we know from empirical data, case studies, and lots of other clinical data out there, that there can be a placebo effect, but there can also be a profound effect. So do what works for you. So that's my second point. Find what works for you, use your evidence base, and ground yourself in it.
I love that.
The third part is, I would always allow an open-mindedness to the approach. And the reason why I say this is because we're on this journey as being humans, and as we age, things change within our body. What works for me now may not necessarily work for me tomorrow.
Oh, that's good.
Through experiences and as we grow, we may start tapping into other body systems. For instance, commonly, I always get a lot of my clients and patients come to me with a core symptom. It may be a gut health issue. They may say, you know what, I just need to reduce my IBS symptoms. But actually, through the journey of my programs, they start realizing that they need to tap into their emotional well-being and their mental aspects, because that has an impact on their gut that they probably never imagined that they would have to tap into. So I always say, keep an open mind to your body and health outcomes, because you will actually tap into other things. A lot of my other clients, actually, we tap into a lot of spiritual well-being, and that doesn't talk to religion. That talks to your own spiritual values, that you then create your own core elements and values that you can then build up your health framework, so that when we do the dietary intervention, it makes sense for them and it aligns with their spiritual values and being. So I always say keep an open-mindedness to your approach, and also just be aware that it will evolve over time. So those are my top three, because I believe in the power of three. Three is my lucky number.
I
There's
love
always
that.
more learnings.
I
Doctors will,
love that.
will
Well,
but
we're going to absorb all those three. And what I love about that, and I feel like a lot of it comes from your journey, because going through the process that you've gone through, just getting your PhD, right? It sometimes we get stuck in a lane, right? And we don't want to move that lane, but it's like all three of what you shared is all about like allowing yourself to turn to the direction of what you need then. Like that might have been good for then in that season of life, but it's like Dr. Sunny saying, like, if you're here with me, you know what I mean? We're going to shift some things. You know what I mean? You're not going to stay stuck at where you're at, like we're going to really look.
Brilliant. I think that's a brilliant analogy. And Galen, there's something like in relationships, when a good relationship, partners always say, stay in your lane.
Yeah.
But we're led to believe that that's a good relationship, that we have our roles and responsibilities and stay in the lane. But actually, that's probably the pinnacle of the worst relationships in society, because we're actually using patriarchal, misogynistic systems. Actually, if you abolish all your lanes and you actually intermingle your highways together, you will actually grow and nurture each other. And that's why I always say to people, just like, forget your lanes, come with me with your lanes. The one thing I always say to my clients is, come to me with all your thinking, because the minute you start a program with me, all the thinking is handed over to me. All you have to do is let yourself go and let yourself live and breathe in the process, because those lanes, as you say, they all just kind of cascade into one huge superhighway.
That is beautiful. Yeah, that's beautiful. I love that. It's like, it gives us license to just live a whole nother level of freedom. Like we don't have to stay where we're at. We can just really walk in a place of freedom. That
100%.
is amazing. And I'm telling you, audience, if you're listening to this and it's resonating with your heart, we want you to know that you are not alone in this process. Okay. And that is why I bring on experts like Dr. Sunny to share, because if you're feeling this, I really do believe is what you put out is what you attract, and what you're seeking is seeking you. And if this resonates with you, I will tell you just to reach out. Dr. Sunny also has an incredible free gift. Not like this isn't really enough. I mean, all the value that you're giving us is like so above and beyond. I cannot thank you. So generous. He also has a free gift. We'll put all the information underneath to be able to get it. But Dr. Sunny, why don't you explain what this is for our audience?
Yeah, so I'm very conscious that I haven't spoken about lifestyle medicine or evidence-based practice. So I'm giving people the opportunity to fill in one of my award-winning frameworks and pillars for health. And that way it will allow me to provide you a free healthcare assessment. And that allows us to kind of start understanding what areas that you may want to focus on from a kind of a holistic empowerment for your health journey. So it's a very simple link. Fill out the answers. That will come back to me and I will send you a summary free of charge.
I love that. I love that. That's so powerful, because to really just have like an assessment of who we are and where we're at, and have you look at that and be like, okay, this is what you need, is really powerful. And it's even just a self-reflection too. I love that. I love that. So in closing, what is something that you want to share for everyone just to leave with today?
Okay, so it's not going to be an appearance from me if I don't mention the gut. Okay.
The gut health, yes.
If we're talking about natural healing and we always talk about gut instinct, I will always say to people, trust your gut and start thinking about gut health more than what we have been, because it is the future, it is the now, it is the present, it is everything for health. And that free health assessment will help you understand gut health a little bit more, and also how I work as well. But the gut is your second brain. It is the most wonderful aspect of health, and it has so many health benefiting kind of profound impacts that we should all be looking into. So everything that we've said before, it all resonates from the gut as well.
Yes, I love that. I love that. I know a lot of you all that follow me are like, oh, now I know why you're obsessed with Dr. Sunny. He's all about gut health. Yes. It's so true. So again, I just want you all to know, thank you so much for being here with us. And I will have all the content for you under here so that you can get in touch with Dr. Sunni and really grab a hold of his free giveaway for the assessment. And if you have any questions or concerns, do not hesitate to contact us. We are here for you on your journey of health and wellness and all things natural. Dr. Sunni, thank you so much for being here with us. You have been such a joy. You've been such a blessing. And I cannot thank you enough for pouring so much into each and every one of us today. You're absolutely amazing, and your work that you're doing here on earth is transformational. And I am so excited that you are not stopping, but you're going to continue to fly.
Well, thank you so much, and kudos to you and everything that you're doing, and thank you for everyone that's listened. And as you said, please reach out, but stay healthy, stay warm, just enjoy the power of yourselves and tap into that energy and beauty that you have within you to transform, heal, and be empowered.
Yes, I love it.